with Dr. O, Advanced Physical Therapy and Wellness, and we'll be starting out with some kind of neural tension of the lower extremities, aka the sciatica and all that stuff. Going straighten out this leg. Good. So first and foremost, you can always check, 90-90, hamstrings, all that good stuff. Definitely has some tightness in its hamstrings. But also too, we'll check out kind of more the sural nerve distribution, which usually runs down right in through here. So we're gonna kind of dorsiflex. Let me know when you start feeling that tightness. So you can tell he's got neural tension because the tightness starts before his hamstrings. His hamstrings kind of give way right in through there. So then the nerve's going to be kind of limiting him, particularly with forward folds and stuff like that, even before the hamstrings are, if he's in like standing. And also too, we're kind of rotating in to kind of hit more of the peroneal nerve, superficial and deep distributions. Oftentimes we'll be feeling it down the leg, kind of down the lateral side of the hamstring. Let me know when you start feeling it. Good. And then how you can kind of see the kind of lateral cutaneous nerve of the thigh, as well as kind of more the cluneal nerve distributions. Let me know when you feel it. So it's kind of internally rotation, and then we'll bring it down just a little bit when he feels it, and let me know when you start feeling it. Coming across the bodies to go in that direction. Wherever he feels it the most is probably the way we're going to be mobilizing using some active release techniques. I would say he was having it a little bit more so, kind of all of them, so I might just do it on all of them, but essentially you're going to kind of adjust the table height depending on where you want his leg. So if you wanted like the lateral cutaneous nerve of the thighs / like cluneal nerve distribution, you would raise it up so that his leg can be coming across the body. Otherwise, the other two, you can kind of do it kind of at the body level. And essentially, go and roll onto your side. So here's how I would kind of treat that, other than, I think we talked about in the spine, kind of coming in the iliolumbar ligament, but we're just going to do kind of the lower body. So we use a stool, go and straighten out this bottom leg here. We'll kind of put the foot right here on the stool. And then essentially what we'll do is we'll kind of bring it down, we'll plantar flex foot, then we'll dorsiflex foot. Tell me when you start feeling it.
Right there.
And then whereabouts you feeling it?
Bottom of my foot, track of the calf.
Okay, right back in through here. That's kind of the spot.
It's a little more
Tender, a little more medial, in through here.
Yeah.
Kind of tender spot. Okay. So he'll kind of tell us where we're going to do like the ART. We're going to like really dig in, plantar flex and dorsiflex and come up. And let me know when you start feeling it. 5. Where I'm pressing. 4.
Oh no, just that way.
2, 1. And then we'll bring it back down. We'll kind of recheck. Let me know when you start feeling it. Now I'm kind of bumping in hamstrings now. And where are you feeling it?
Bottom of the foot and calf still.
Same spot?
Yeah.
Right in here.
Maybe push it a little more.
Anything in through here?
Yeah, I think
Some in through here. Sometimes we'll find it kind of where that soleus meets the gastroc. So I'm going to kind of dig in through there, and then we'll go up. Feeling it. We'll go 5, 4, 3, 2, 1. Good. And then, where are you feeling it now? I'm kind of running the hamstrings now for the most part. So at this juncture, I'd probably just stretch his hamstrings out. May do like a cup there in the future or something like that, cup that, or you may be able to do some ART in through the bottom of the foot. He's having it right through there. But pretty good. Go and roll onto your back. Then always kind of retest. Shake this leg out good. And then let me know when you start feeling it. Nice. So we went from here to all the way up through here. And that's also too where his hamstring is bumping up too. So I'd probably at that point maybe stretch out his hamstring some with like a PNF, improve that, and then maybe go one more round of that, and then we go like, whoa, when we go like way up here, but of course the leg will be straight. All right, so that's how we kind of do that. And you just kind of, they just kind of find, you find based on where they tell you, and then you kind of retest and go a little bit further.